Welcome to Fourth Trimester Voices. Today we're going to talk about going back to work. Mom, you must have a lot of anxiety surrounding this. You just literally got home, but you're already thinking about how it's going to be when you have to get up and leave your child and go to work. And some of you have planned for this, others, maybe it's not something that you've thought about until now. So I want to just talk through what all of this means. I want to talk through preparing to go back to work and changing your mindset so that you may be able to cross this hurdle because it's a big one. Now, for me, I had to go back to work after 12 weeks. Before I delivered, I had some complications with my pregnancy. I had what we say preterm contractions, and those were aggravated by doing my long shifts, dehydration. And so the decision was made that I would take FMLA, which is Family and Medical Leave Act. I would take FMLA and I would sit out the last, I believe, 4 weeks of my pregnancy. Unfortunately, using FMLA during my pregnancy cut into how much time that I was going to have after I delivered the baby. So I delivered at 40 weeks and 6 days, and my FMLA started right there on the dot. Now, FMLA usually provides 12 weeks of leave, and it's not paid for everybody. In America, we don't have a mandatory maternity paid leave. And so for me, within my job, I believe, gave 6 weeks of paid. It's like a short-term type of a disability. They pay for those 6 weeks, and then the other 6 weeks of FMLA, you have to figure it out. I took 4 weeks of FMLA during pregnancy. That was paid. Had 2 weeks of unpaid. I had 2 weeks of paid FMLA in the postpartum period. And then the other weeks that I had, the 10 weeks that I had to request. I had to sit down with my chairman and I had to ask him for more time. And I needed documentation from my physician saying why I needed additional FMLA. Now, my chief didn't really question it. He just knew that I needed more time to bond with my baby because even though I had taken 4 weeks off in the pregnancy period, that 8 weeks would not be enough to get me to the place I needed to be. And so, really anxiety provoking time. And this really fueled or motivated my discussion today because I have a lot of friends who have a lot of questions about this. They don't know how they can negotiate to have additional time with their job because our country just does not do a good job with this. So let's talk about the statistics first. The US is one of 6 countries globally without a federally mandated maternity leave. Think about how many countries around the world exist. But America is one of those 6 that does not mandate jobs to pay their employees to be off for medical leave. 23% of private sector workers have access to paid family leave. 23% of employees, 23% of people or workers have access to paid family leave. That means that not a lot of employers out there are paying their clients while they're off on FMLA. And for those covered by FMLA, the leave, I want to clarify that the leave is generally unpaid and only the employer has control if they're going to pay you during that time. Okay. So one, you have to jump over the hurdle to see, do I even qualify for FMLA? And, that basically means, am I full-time? Is this something, do I have enough hours? So a lot of employers have criteria that will say if you qualify for FMLA. And then after that, you have to think if your job is actually going to pay you for being off. And as you can imagine, having FMLA and being unpaid for 12 weeks, for most Americans, that's a huge chop in their income. So a lot of moms have pressure to go back to work, go back to work after 4 weeks, go back to work after 6 weeks. There's a lot of pressure to go back into the workforce and basically make money. Now, let's think about what the societal impact of not paying moms to be home with their children. What is that doing to our children? What is that doing to mom's health? Overall, moms, you can think of how long moms need to heal from giving birth. C-section alone, moms need 8 weeks. I mean, that's a huge surgical incision that a mom has undergone. So now imagine going back to week after four, going back to work after 4 or 6 weeks, and physically, you're not even recovered. That C-section scar is barely coming together, right? And then imagine if you've had a complicated delivery, you've had a complicated vaginal tears. It's not enough time to recover, right? For a lot of women, they're still dealing with chronic pain. They're still dealing with pelvic floor issues. They're still dealing with mastitis, still dealing with breastfeeding issues. And now they have to go back to work. How fair is that for women in this country? And let's not even just talk about physically what a mom is going through. Let's talk about mentally, the mental toll. For a lot of women who've never in their lives suffered with depression, never in their lives suffered with anxiety, they're now being debilitated by anxiety and depression. And now, when they have to go back to work, all those symptoms are exacerbated, right? How efficient is this person going to be at work? And depending on what field they have to go into, whether, they're using their hands physically, they have to be on their feet, they have to utilize their brain in order to function and serve people and help people and, tasks at work. They have to be at 100%, but they're not. And so when you force a mom to go back to work when she's not fully recovered physically or mentally, it is just unfortunately exacerbating her symptoms and also prolonging her healing and setting her up for chronic pain and setting her up for complications that will go beyond the postpartum period. And so that's the toll that it has on mom. Let's talk about the toll that it has on baby. A lot of studies show that there is a benefit in babies having their moms there extended in the postpartum period. It is good for improving attachment. It's good for improving breastfeeding rates. If you don't know why breastfeeding is important, I have a few episodes that you can check out that talk about the benefits of breastfeeding to mom and the benefits of breastfeeding to baby. But babies benefit hugely from breastfeeding. So if you're forcing a mom to go back into the workforce at 4 weeks, at 6 weeks, and who knows what the pumping, if this room, if these employers have pumping rooms, if there are concessions made for her to take the break to go and pump. And so a lot of women stop breastfeeding once they have to go back to work. The lack of time for bonding is definitely going to lead to higher stress levels for mom and baby. Now, for employers, they don't necessarily want to hear about the toll on babies or the toll on mom. A lot of them want to know, like, how is it going to affect business? What is the bottom line? Tell me about the dollars. And so this is the difficult thing with our system. We're always thinking reactively. I mean, you can think about the healthcare system in America, right? We don't want to spend a lot of time on preventative care. So therefore, we allow people to go through life with untreated medical problems, no access to medications. And then when they show up with their life-threatening diabetic crisis, their life-threatening hypertensive crisis, then we're spending thousands of dollars admitting them into the hospital, admitting them to rehab facilities. We're spending thousands of dollars trying to fix a problem that could have been prevented. So it's costly to allow people to get to a point where there is now disability, where there is now long-term complications and high rates of hospitalization. That costs thousands of dollars. But how much does preventative care cost? Way less. So I like to approach this view with employers in the same way. So my old job, I had a project, and my project was, I was very passionate about this. I used to review patient complaints and Some patients had trouble accessing an area to pump when they would go inside the hospital. And so because of this, I took a survey. I surveyed, employees who worked where I did and asked them if they had the same issue. And many of them had the same issue. But in order to present this information to the C-suite or the people in charge who were making the decisions, I had to come with them with the money. So let's talk about it, right? Women without access to paid leave are more likely to leave the workforce entirely. So women are just going to be out. So you're just going to be out of employee. Think about what that does for you on your productivity, right? Employees who literally have to go back to work early are going to be less productive. What is the cost of productivity, right? Let's say if you are a physician and you have to see 25 patients per day, and now you're going back to work physically, you're not where you need to be walking around seeing all these patients. Mentally, your mind is somewhere else. You are not going to be able to see that number of patients per day because physically, mentally, you're not there. So your job is going to see less patients, which in turn is going to see less revenue. So this is how I like to talk to employers. Now, America's going to do what it does, and we'll keep preaching this and keep preaching this to employers, but the tide changes slowly. And so these are the things that you have to consider when you are looking for a job, right? Let's talk about planning in advance. What are your policies when it comes to maternity leave? Do you pay your employees? What are your policies when it comes to breastfeeding and pumping? Do you have a dedicated pumping space when I work here? And so I know most of us are not thinking about this, especially if you've started at a job at a young age. You're not thinking about asking these questions, but you want to be in a job that you love and you want to stay there. You don't want to leave because they're not supporting your desire to have a family. And so these are extremely important things to ask. Now, I like to compare America to other countries because it's perspective, right? So there's some places in Europe that have greater outcomes. They have higher, what do you call it, standard of living. That's not the word. They have higher life expectancies. They have, better maternal mortality rates, better infant mortality rates than our country. And so we have to ask ourselves, what are they doing? Let's talk about Sweden. Parents in Sweden receive 480 days of paid leave. And this can be shared amongst partners, so they could split it. Canada, mothers are entitled to up to 12 months of maternity leave. I remember going to visit my cousin who gave birth in Canada, and she was home for a full 12 months. And she was guaranteed that when she went back to work after 12 months, she would have her job that would be intact. These maternity leave policies correlate with better maternal health outcomes, better child health outcomes, and increased workforce retention, and overall better societal benefits. So why are we lagging America? Why? This is my plug, right? This is my plug for better maternity policies in this country. But besides that, I know you came to hear about how you can do this despite our policies. So, number one, I talked about this earlier, and that is financial preparation. In a few episodes in the future, I promise you that I am going to bring on a financial person to come and talk to you all about how you can start planning and budgeting. Number one, you want to assess your budget as a household. If you have areas that you can cut back as a family within the year that you're pregnant, I mean, within the 9 months that you're pregnant, or even a year before you even give birth. I know things happen and, it's not, planning is not that easy when it comes to birthing a child. But if you could do things perfectly, I would say before you think about expanding your family, assess your budget, cut back, put money into your savings, and specify that this money is for when we are going to start a family. because not only do you need it for unpaid leaves in the future, but you're going to need this to build your village. You're going to need it for, certain things that your insurance will not cover. So definitely start planning, start budgeting. All right. Once you do that, talk with your employer, see if they offer things like short-term disability. So a lot of short-term disability plans will cover your pregnancy. So this is important. And if you are already in the postpartum period and you do have short-term disability and want to know if you can extend your time while you're home, definitely look into this. Some short-term disability plans require that you have a qualifying diagnosis. For example, a back injury, debilitating pelvic floor. I'm giving you some keywords, wink, wink. Debilitating pelvic floor issues. There's a lot of things here that you can sit down and talk with your doctor about so that you can be able to get short-term disability. I'm not advocating for you to abuse the system, but if you're truly having a difficult time with physical limitations, mental limitations, please contact your employer to see if short-term disability is an option for you. Okay. Um, the next thing that you want to do while you're planning to go back to work is plan on your childcare. Mom, I don't know if this is your first time or second time having a child, but childcare is rough. Now, if my mother, who had all of her children in Africa, struggled with childcare across the globe, where there is a community of people available to take care of us, imagine what happens in this country where community is not necessarily the same. And so I don't think I estimated how difficult childcare would be, right? I didn't research much about daycare, guilty, right? I didn't research much about nannies. I didn't research much about au pairs. I just had to figure this out on the fly during the postpartum period. Right. And so I had to think about what I was going to do. And so bringing family, I alternated with family. I tried au pairs, which didn't work out. I tried in-home nannies. So eventually, when my daughter was 2, she went to daycare. We struggled with daycare facilities, so childcare is a nightmare. I used to look at one of my friends who went touring, every single childcare facility during pregnancy. And I used to just be like, man, she has a lot of energy because that's not how I function. So I just encourage you to do that planning upfront. You may not want to wait till you are in the thick of things, okay? And if you have one plan, always plan on a backup plan. Identify friends, family, trusted individuals who can step in when the primary childcare is unavailable. Also, think about what's going to happen if the baby gets sick. Who's going to take care of the baby? If both of you work, who takes off? Who has more flexibility in their job? These are all conversations that you can have with your partner. And if you don't have somebody who's helping you raise this baby, these are conversations that you can have with family members. All right. And if your only option is childcare, really do your due diligence. Go and research these places so that you may feel safe leaving your child. Because one of the biggest things about going back to work is the anxiety knowing that your child is not with you. We all think that we are best equipped to take care of our kid, right? We had that maternal instinct. We carried this baby for 9 months. We've bonded for that 6 or 12 weeks. And so ultimately, we feel that we are the best caretakers. And so when you now have to give your child to somebody else, whether it's family, whether it's childcare, that's a huge mental load that you have to take to work. And so if you can plan in advance for this, please, 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 please do it. Let's try to help you prepare emotionally for going back to work. Acknowledge your feelings, Mom. This is hard. You're going to be anxious. You're going to feel guilty. The guilt is truly what I think most moms feel. Guilty for leaving your child at home or in the hands of somebody else. This is normal. Give yourself grace. to feel all of these feelings and process. Once you feel and you go through that, build yourself a support network. If you know a few moms at the job, connect with them. Ask them, how did you do it? If you have a few Facebook groups, talk through it. One thing that I did when I was postpartum, I've shared with you all, I've had postpartum depression. I went through with my therapist what I called a postpartum return to work plan. And so within about, I think with about 4 weeks pending to go back to work, we broke it down. We went through everything. We went through childcare. We went through, pumping, what to prepare, what to pack in my bag. We went through and talked about my emotions, how to deal with, if I had an anxiety attack at work, and just trying to give me the tools that I needed to prepare me for that. Because for me, I needed that advanced preparation. I realized once I got into the thick of postpartum that planning should have been my focus. Um, but it wasn't because I was like, Psh, I'm a doctor. I got this. Psh, we gonna do this. Yeah, no, do not be me. Okay. You want to prepare yourself mentally and physically. Now, part of that preparation of your emotions and mentally is to create realistic expectations. Okay. Understand that work and motherhood can be at odds sometimes, and you're going to have to find a balance. Other realistic expectations, your husband's going to be okay. If he's taking care of the baby while you're working, he may not, have her in a bow packaged well. She may have lots of spit up. Like she may not get to napping at exactly 2 p.m. Let's set realistic expectations because if you try to control everything, you are really going to have a difficult time once you go back to work. And so set realistic expectations. Is my child fed? Is my child getting the rest that they need? Do not spend time obsessing about what they're wearing. Do not spend too much time obsessing about how much playtime did they get that day. You are in survival mode. You need to get through that work shift. So start by writing down your expectations realistically, and then try to remind yourself that being a working mom is not a reflection of your love for your baby. Working and being a mom does not say much about how much you love your child. So let go of those unrealistic expectations and know that things are going to be different. You're a mom now, but you also have to go back to work. All right. So other things that are really important is creating routines. One of the things that I would do is when I would get off of work, I would rush into the car because I wanted to breastfeed my daughter, when I got in the morning. So I worked overnights. And so I would not pump towards the end of my shift and I would get off of my shift, get in the car and jet to try to catch my baby when she woke up. And I would spend that time in the morning breastfeeding and bonding with her before I would give her up to my mother-in-law, my husband, and then go take a nap. And so that allowed me to feel close to my daughter, and not feel so far away like I was doing something. And so that was a great ritual that I did for myself. Now, as she got older and her sleep patterns became all crazy, it was more difficult to, try to rush home and get there before she was hungry. So oftentimes I would go home and she had a bottle already. But it was okay. Because I had to set realistic expectations. Is she fed? Is she clothed? Is she sleeping? And so I was able to let go of that. Once you are able to kind of plan, mentally, emotionally, let's talk about physically the things that you're going to need. So you're going to want to build a milk stash. Um, don't go crazy with this. I know there's a lot of information on TikTok, or the internet where moms have these freezer stashes full of like so much milk. You don't need to do all of that, mom. You just need a couple of different, a couple stashes of milk, and you can start by pumping, 4 to 6 weeks in advance to kind of have some extra milk in the fridge there for your child when you go back to work. But also remember that if you're going to work and you're going to be pumping at work, you're going to be producing enough. So really you just need enough milk for 48 hours for your child that's in the freezer. So don't go crazy trying to, have 100 days of milk stash in the fridge. Everybody is not built like that, so don't feel guilty because of that. Okay. And then really practice using your pump and getting comfortable with the process at home. You could also check if your work has an industrial size pump. So my job, we advocated to have an industrial size pump so that all the moms could just bring their own phalanges and would be able to pump. And so if you don't have that at work, hey, that's a project that you could do for other moms. It's just get an industrial size pump or not or help your employer purchase that on behalf of everybody within your workforce. And so practice pumping, figure out what that looks like for you, and get comfortable with it at home so that you could be able to do that at work if that's what you choose to do. Familiarize yourself with the lactation policies at your job. Where's a lactation room? How many minutes can I be gone? How many breaks can I have in a work day? I just require to pump twice, but other moms 3 to 4 times. And so you can sort of figure out as you're going through breastfeeding your child throughout the day, you can kind of figure out how often you need to pump. And so this really depends on, your infant. And so you're going to figure this out. Ideally, I would say you do want to pump at least 2 to 3 times within an 8 hour window, because you don't want to get engorged because then you get into getting mastitis, and all sorts of other things. All right. So the biggest part I would say of going back to work is really talking with your employee to see their lactation policies because this will affect your feeding relationship with your baby. And then while you're kind of gearing up, make sure that you're resting, you're figuring out, you're on in a good routine with your baby and your nap taking. Make sure that you're hydrating, make sure that you're eating a nutrient dense diet to support healing and energy levels and incorporate light physical activity, such as walking, yoga, because you just want to find ways to be able to boost your energy, lighten the mood, and relieve stress. Okay. Now, when you're about to go back to work, make sure you have open communication with your employer. Talk about how many breaks you're going to need, talk about your pumping needs, make sure it is in writing, put it in an email, organize how you're going to be productive at work. When I first started going back to work, I would sit with my phone next to my computer and I had a video camera watching my child sleep, watching everybody take care of my child. That was a little pathological. Okay. I would recommend not doing that. Okay. Yeah. That was not my proudest moment, but I told y'all I was anxious. And, that was one of my anxious activities. I would spend pretty much all day doing that. Now, at one point, I think we decided between, me and my husband that we were going to cut the camera off during the day so that I wouldn't stalk them. So, you know, and the camera would just go on during sleep. And that was actually a really good intervention for me because I didn't have to watch the baby constantly. So figure out your pain points, and just figure out how you want your work routine to go. And that may include checking in and calling home or FaceTiming your baby. Just try to figure out those things that are going to help you get through the day. The first few weeks going back to work are really challenging. And so you definitely want to figure out a routine so that you're not caught off guard. Now, the night before you go back to work is probably going to be, really hard for you to sleep. Let's just be real. So try to plan everything out. Make sure your bag is packed. Make sure you've gone through that everything is in there. Lay out your clothes, prepare your food. And you're gonna get through it. You're gonna get through it. Okay. I don't know who this episode is for, but going back to work is challenging and you are not alone. Many moms have done this. I think every day in my Facebook groups, there's a mom anxious about going back to work. Just the other day, a mom said she had a nightmare where she was back to work and something happened to her child. And, so you're not the only one thinking about this. Many moms have this anxiety. And unfortunately, our society has created this because we don't give our moms enough time, right? The lack of paid leave in the US is an issue, and it is affecting how quickly we recover from giving birth. And it's leading to complications with our bodies, complications with, mentally, so all the complications that come with postpartum depression and anxiety. So, yeah, I just think we need to do better as a society. We need to do better talking about this. And, if you have a story that you want to share or talk about how you prepare to go back to work, please, send me an email on fourthtrimester voices@gmail.com, or you can find me on Instagram, Dr. Choa, and let's really bring attention to this topic. Again, if you're having a challenge trying to figure out where to start and how to process all of this is what I do, right? I am your postpartum advocate. I'm a postpartum on-call doctor. People pay me to do this and help them. So if you are in Atlanta, Georgia, and you need additional assistance trying to navigate how to plan to go back to work, how to plan for your postpartum, please, please, please send me an email, send me a DM. I'm here for you. I want you to thrive in the postpartum period. I want you to be able to go back to work and say, wow, this is so much easier because I planned for this. All right. That is it on today's episode. Give me a call, give me an email, DM, find me on Instagram. Would love to hear your stories and your tips. All right. You take care. Bye bye.